Hello, good afternoon. My name is Rich Saunders, Chief Innovation Officer for Governor Cox and the administration. Grateful that you're here today. Thank you for taking time out of your busy schedules to be with us today for this important announcement and effort that we've got going forward. Last January, you will recall it was the beginning of the Cox-Henderson administration. And at the time, they released the One Utah roadmap, which contained the policy priorities for the state of Utah moving forward. And as the Chief Innovation Officer, Governor Cox has placed the responsibility of those efforts into my hands. Today's discussion and announcement will revolve around one of the strategic priorities, the health security strategic priority. And I wanted to thank the visionary group, some of which are here, for the work that they did leading up to this administration and what eventually turned into the One Utah roadmap, and these important strategic priorities that we are moving forward at a very accelerated pace. And I also want to say that the state of Utah is very fortunate to have the aggressive, visionary, thoughtful, and very compassionate leadership in Governor Cox and Lieutenant Governor Henderson. It is remarkable to see, and we are blessed as a state to have it. I wanted to also say that under this leadership, some very big initiatives, very big goals have been set forth, and it's exciting to see that the state is rising to this occasion. There is a lot going on and a lot of people rising to an incredible effort together. It's neat to see the unity take place. I'm thrilled also today that the administration is going to be making this announcement that has to do with this health security strategic priority. It's bold and it will be disruptive, but I think, and as many of us has talked together before, as long as we're coming together and united in this effort, we can go somewhere special in this effort. I also extend thanks to the many, many individuals and the many hours of work that have been employed to get prepared for this announcement today. The strategic priority team that has been led by Ryan Morley and such great teammates that have been putting together many good to prepare for this event. Also in recent weeks, dozens and dozens of experts and key influencers in this subject have given their feedback and their perspectives and their commitment. I only wish we had time for each one of you to come up and share that passion and that commitment that you shared with us as we prepared for this event. We don't have time, but fortunately we have a couple of them that are here with us today that has asked to come and share a few of their thoughts. I would invite the media to take the time to interact with any of the individuals here that have given their pledge and their support for this initiative. Some of the names of them have been distributed on the media advisory, so we invite you to connect with them if you would like to do so. Thank you for being here. Thank you for the great work that you do in the state of Utah that help to contribute to Utah being a leader in the nation in the health space. You are remarkable people, and the work that you do is remarkable. So with this, we'll turn the time to the governor.
Ladies and gentlemen, it's an honor to be here with you today. Thank you so much for joining us in this beautiful place with terrible acoustics. We appreciate you putting up with the sound today. Let me begin where Rich ended by thanking you, especially our healthcare providers from across the state who have done so much over the past 18 months and always. We are grateful for your service and your dedication and excited about the future as we move forward together. Several years ago, Derek, it's good to see you. I was thinking about you. I were engaged with Governor Herbert in a big debate that was happening here on Capitol Hill around expanding Medicaid. You'll remember those days well. And I remember on one occasion sitting down with Representative Jim Dunnigan, who was kind of leading and we were going back and forth on whether to expand Medicaid or not. And I just said, Jim, Utah is known for innovation. Utah has been known for working together to decrease the cost of healthcare and improve outcomes. Wouldn't it be great if we could start working on those things again instead of arguing for year after year about Medicaid expansion? I felt like we'd taken our eye off the ball when it comes to at least government involvement in the healthcare system. I'm excited today and proud today of the work of everyone in this room to talk a little bit more about how we can get our eye back on that prize and start working together. Now, over the past couple years, now 18 months at least, we've seen some issues that have come out of COVID and some opportunities. I believe that we have an opportunity right now to rethink the way our whole healthcare ecosystem works in serving Utahns. Because of what we've learned over the past year and a half about the power of collaboration and reaching beyond our customary boundaries, I'm confident we can accomplish what we are going to be proposing today. We have a crucial problem in our country, and Utah is not immune from it. The problem is that we have for decades been building, and again, many have tried, but for decades, we have seen as we've built this healthcare system, healthcare costs that continue to rise, making it harder for many people to maintain access to proper healthcare, and inequities are compounding in our current healthcare system. It's so easy to focus on treatment rather than health and prevention. Additionally, I have to say this, healthcare is an economic imperative. Over the next decade, outsized rising healthcare costs will stunt Utah's economic, drain employer profits, decreasing employee wages, and crowd out other state spending priorities. There are two consequences of this. The first, of course, is the unsustainable explosion of cost. The cost implications threatening our economy, with healthcare becoming unaffordable and employers and individuals being unable to pay for it. Let me just give you a couple examples of this. Since 2010, average premiums in Utah have outpaced wages by 17%, equating to $612 million per year in additional premium costs shouldered by employees and their employers. For individuals, 66% of all bankruptcies, 66% of all bankruptcies are tied to medical issues. And it affects not just people and their employers, it impacts the state budget as well. Basically, over the past 20 to 22 years, the Medicaid spending as a percent of general fund have roughly doubled. Unsustainable, even accounting for the increased federal cost sharing during the pandemic. And when you think about that, every dollar we spend on Medicaid in this state is a dollar that we don't have available to spend on education, to spend on transportation, and other critical government operations. The second consequence of this, unfortunately, it would be one thing if we saw these costs going up and our healthcare outcomes were improving at the same rate. But unfortunately, that's not what is happening. We're continuing to see declining clinical outcomes and inequities that are expanding. According to many health measures, the good news is that Utah is better than just about any other state when it comes to lower rates of alcohol use, smoking, and many other chronic illnesses. But we are not immune. As one example, we are seeing, unfortunately, significant increases in diabetes, a 3% increase from 2000 to 2018. And according to projections, we're expected to see diabetes grow significantly here in the state of Utah from a number of about 63,000 adults in 2015, with some projections up to 250,000 adults by the year 2065. We're also seeing increases in heart disease, preventable cancers, and other chronic illnesses. And then, as I mentioned, the inequitable outcomes that are unfortunately became exposed, especially during COVID. Rural counties in Utah have a higher obesity rate, higher rate of diabetes, and lower life expectancy. There are also discrepancies in our communities of color, which have been hardest hit by the pandemic. In South Salt Lake, for example, life expectancy is a full 10 years lower than just 3 miles to the east. We have to do better. I'm making healthcare a top priority, as Rich mentioned, for my administration, not only because I care deeply about the health of Utahns, but also because there is an economic imperative to change. Now, I want to be very clear. Utah has an incredible healthcare system. We are so very blessed and fortunate to have the best minds, the best healthcare workers anywhere in the nation. But being the best of a system that is broken isn't something to celebrate. It just means we can do better, and we can do better together. So starting today, Utah is going to lead out on one of the most transformative and visionary healthcare efforts in all of the United States. I'm inviting all of you to join us in this journey. It is big and it is bold, and it will take all of us working together to accomplish. To maintain our economic competitiveness over the next decade, I'm calling on the community to set a goal initially to limit and then reduce the growth of healthcare costs in the state to never exceed the growth of our economy. And in this process, continue to provide high quality of care and eradicate inequities in that care. Healthcare costs that grow at or below GDP will require hundreds of changes to the way we deliver, pay for, and measure success. Such a goal will never be accomplished in silos. It will require bringing together professionals and communities that have not historically worked closely together. We're talking, of course, about medical professionals, public health professionals, social services, community-based organizations, and insurance providers. I'm making a call to action to participate in this objective because we need each of you. We have to build a system that focuses on health and not just health care. Now, to facilitate this goal, I'm excited today to announce the creation of a new health collaborative that will convene many partners with the objective to reduce costs, improve clinical outcomes, and improve the patient and healthcare provider experience. This Utah Sustainable Health Collaborative, as we're calling it, will be neutrally managed. This is very important, right? And serve 4 core functions. The first will be to act as a convener and steward as we collaboratively chart the course and hold ourselves accountable to these goals. The second will be to serve as a site for innovation through pilot initiatives. Now, we recognize that many of you, all across the state, there are incredible pilot programs and initiatives happening right now. Unfortunately, they're all happening in silos. The center will unite those efforts so that we can collectively address these issues, learn from each other, fail fast, and give us a powerful ability to scale successfully. There is no single action or program that can change our system from one of healthcare to health. It requires hundreds, if not thousands, of changes. It requires partnerships with payers, providers, community organizations, government, and patients. It also will capitalize on our Utah ethic of collaboration, innovation, ingenuity, and organizational resources. Now, third, this collaborative will provide support to providers that enable them to make the kinds of changes that they need and want to make. And fourth, we collectively will recommend policy and infrastructure changes that would remove barriers to improving health. Now, this collaborative will be at the crossroads to develop a 15-year plan for healthcare sustainability in our state to provide resources for its success. We know that this won't happen overnight, but the collaborative must be not top-down. It must be patient-centric, population health-centric, not political-centric, not profit-centric, patient-centric. And if we do this, it will not be driven by the source of its funding, but rather by the right thing to do for Utah residents. It's much bigger and effective than a think tank. That's not what this is about. It's not just a bunch of people in a room thinking together. It's a coordinating center for action. It will be a workshop environment that builds and proves effective health delivery models where we teach and learn from one another and enable us to scale successes so that everyone can benefit. Now, as governor, I also promise that I will do my part. The state oversees the health benefits of approximately 14% of Utahns through the Medicaid and state employee health insurance programs. We have been innovative, but we can do more and will continue to be. We will share what we are learning. We will coordinate with others to amplify lessons, and we will adopt solutions that others find and bring to us. I want to share just a couple examples of projects that the collaborative could take on. It could include integration of behavioral and physical health, initiatives that address social determinants of health, which are factors like money, healthcare access, education, and neighborhood that impact the quality of life and health outcomes. Pharmacy efforts that would include medication therapy management, expansion of successful opioid efforts that have saved lives in our state, and increased care coordination for patients in rural areas. The collaborative will be a leader in fostering these innovations and supporting programs across our state. Now, transitioning to a focus on health instead of healthcare will take time, but is one of the most meaningful and economically essential legacies we can create for Utah's future. We want to make incremental, informed changes across the healthcare system, and we want to evolve thoughtfully. Now, you've heard far too much from me, but we are so excited. We've been out visiting. Rich, had some meetings. Rich has met with so many different people, and we're going to hear from a couple of them today. But specifically, I want to thank so many of you that we've met with. We couldn't do this without the support of Intermountain Healthcare, the University of Utah Health, HCA, Steward Healthcare, and the Utah Hospital Association, who are here with us today. We've also visited with legislators, and I want to recognize President Adams. Thank you for being here with us. We're so grateful to have you and your leadership. We've met with the Speaker as well as other legislators who have been able to join us. Public health experts, business leaders, community-based organizations, insurance payers, and many others, all with very strong support of this vision and a desire to participate. So now we've invited a few members of our community who have been leaders in this change and will be essential for our success to join me in offering some comments. First, we'll be privileged to hear from Dr. Pennington on how value helps physicians practice the way that they want to. And then we will hear from one of our big employers in the state, Amanda Covington, on how value-based care impacts employers across the state. So with that, we'll turn the microphone over to you, Dr. Pennington. Thank you.
Thank you. Excuse me. Thank you, Governor. And I'm very pleased to be here this afternoon to share with you some of Granger's experience working in the value-based programs. Granger is actually one of the largest independent physician-owned clinics in the state. We started almost 70 years ago, and we were started by the first two physicians to start practices west of the Jordan River. Today, we're about 180 providers across about 4 counties. You know, as a physician, no one needs to tell us that the healthcare system is broken. We spend all day long in exam rooms talking to patients, learning that the patient who's coming in with hypertension does not have blood pressure under control because they can only afford to take their medicines every other day. We see the diabetics that come in, and they never started the medicine we prescribed a month ago because they can't afford to fill the prescription. We see patients that put off getting health care that we recommend because they can't afford it on their high-deductible health plans. The United States spends more than any other developed country on healthcare, and all the standard metrics of healthcare, infant mortality, life expectancy, we're the bottom among all the developed countries. So Granger started our population health program almost 9 years ago. We wanted to create a more proactive approach to helping our patients stay healthy. That, to me, involves reaching out to patients to help them remember when it's time to come in for a recheck on their diabetes, to remind them maybe that it's time for another annual wellness visit, to help them figure out how to connect with the resources they need to deal with the problems they have or to find them resources to help them stay healthy. Back in the 90s, I've been practicing for a long time, all the experts in healthcare thought they knew how to control healthcare costs, and they had these great ideas, and none of them worked. But the things that we've been implementing over almost the last decade, we've been able to demonstrate improved patient outcomes and decrease costs with many of these programs. For example, the first program we started was a program to help patients transition from the hospital back to their home setting. We knew that a lot of readmissions happen because patients don't understand or get confusing direction about what to do with their medications when they go home. They're not sure when they're supposed to follow up. We had a patient we called once who had been diagnosed with diabetes, admitted to the hospital, sent home on insulin, and when we called them the next day, they said, "Oh, I think I'm done with my insulin because I ran out of syringes. They only gave me 4." So we find problems like that in the healthcare system. The investment that Granger made was to hire a couple new team members and start a program where we first had to develop a system to figure out when patients went home from the hospital. And that wasn't trivial, that was a major undertaking. Then we started calling the patients. We would review their medications with them. We would review what they were taking before they went into the hospital and how it matched with what they thought they were supposed to be taking after they went home. And we helped them schedule follow-up visits. Almost immediately, we were able to demonstrate a 15 to 20% decrease in readmissions with just that simple program. Since then, we've added many additional programs, and most of them we've been able to demonstrate really strong benefits for our patients, and some of them we've been able to demonstrate decreased costs. Some of these programs we can find funding for through the traditional health insurance system, but others not. So, for example, one of our most recent programs is we started a collaborative with the College of Pharmacy up at the University of Utah to integrate pharmacists into our primary care practices. These pharmacists provide an invaluable insight into potential medication interactions. Maybe this medication is too expensive and they can help us find an alternative. Maybe our patients who can't afford meds, they have resources to find them ways to afford the medications. The pharmacists have been very helpful for our patients. The patients love visiting with them, but so far it's been funded by grants from several of our payer partners, but almost none of our payers pay for this service for patients. That means that our grant funding that we have is probably not a long-term sustainable approach to providing this service. As I thought about this initiative, I could certainly see that it could help us. Being an organization, a hub that can pull the right people together to discuss the best approaches, to share successes, I could see that being very valuable. Potentially being a funding source for some of these innovative programs until we can prove that they have a good return and the insurance companies are prepared to cover them. Perhaps helping us to consolidate data. Right now, data is split among many payers and many partners, which makes it hard to measure outcomes effectively and appropriately. I know that all of us involved in the delivery of healthcare, everyone I talk to, shares common goals. We want to help our patients be healthier in a more cost-effective manner, and I firmly believe that working together to solicit ideas, to work together to share what has worked and what hasn't, is the way we're going to solve this problem. Thank you for your time.
Good afternoon. It's a pleasure to have had the opportunity to work with the governor's office and to learn more about this initiative and to be invited here today to talk to you from the voice of business. I represent the Larry H. Miller Company. We're excited about this initiative and grateful to the experts in the room for your expertise and for sharing your talents with this cohort who's coming together to solve problems. It truly is the Utah Ethic Governor, and thank you for pointing that out. At the Larry H. Miller Company, we're centered on a foundation of values and guiding principles. And we believe that this commitment to that core and who we are then allows us to be nimble and flexible and forward-thinking as markets evolve and the workforce changes. We're seeing that here in the leadership in our state, tied to Utah values, yet flexible and nimble and agile enough to adapt and to innovate and to lead. We appreciate that. I'm excited to see a variety of stakeholders here, everyone from companies, institutions, organizations, and all perspectives. This is what continues to make Utah great and will allow us to determine solutions for people who live and work here for generations to come. An interesting statistic that has been shared with us, and we know as a business, we participate in this from the Levitt Group, is that 60% of our state is commercially insured. That's among the highest in the nation. And most of that is from employers. We are the biggest purchaser of healthcare, not the government. So it's imperative that businesses are at the table, and we're excited to be invited to participate in this. We hope that we can help benefit this great state. As an employer, I'd like to talk first about the priority we put on our employees. The governor mentioned patient-centric. We're employee-centric, it's the same. It's essential that our employees are living their very best lives possible. We want them to have education, access, care, and support they need to care for themselves and their loved ones. It allows them to come to work and be present, successful, and engaged. Our approach to healthcare at the Larry H. Miller Group for our employees is a holistic approach, and that's what we find complementary to this announcement today. We want to be transparent and collaborate between the employer and the employee and create a relationship of trust. So we are doing our best to be proactive and know that this will help elevate those efforts. Our core benefits philosophy at the Larry H. Miller Group is health, culture, income, wellness. Those are foundational building blocks, and we prioritize them as strategic enablers to economic success. If those are in place and those are functioning well, we know that we can accomplish organizational goals and objectives, and that's in large part due to successful employees. As part of our offerings, we are very engaged in preventative care. As you know from the Miller focuses, diabetes is a big priority for us, and getting in early is very strategic for us with our employees as well as our community. We also are embracing a robust telehealth program and prescription drug services to reduce costs and offer better customer service. We, like many of you, have comprehensive employee assistance programs, lunch and learn programs to meet and tell people about other ways they can improve their lives, and really focus leadership development that helps employees not only learn, but engage, role play, and problem solve on a variety of competencies and issues. We also offer financial wellness programs, flexible holiday schedules, not only so employees can commemorate a holiday of their choosing, but also to maybe take a mental health day or give back in their community and find a sense of connection. Overall, we want to ensure our employees are informed consumers of their health care and that they're actively engaged and that they're proactive. We also want them to have choices in the services that they're paying for. So beyond the focus of our very own employees, we also want to be part of this great community of providers. And I would be remiss if I didn't stop just for a moment and say thank you to those who've been on the front lines, especially during the pandemic. We see you, we appreciate you, and we need you. To close, I just want to say that there are so many facets to ensure quality health care in our state, and it includes all things, including starting upstream like social determinants of health, preventative programs, education, service, quality of care, and a strong ecosystem of providers, and also innovative solutions in medicine. We appreciate you, Rich, and the governor for this work, and for those here today who are leading out to ensure that businesses, not only here in our urban, but also in rural Utah, are able to attract and retain talent and continue to look for economic growth and success. Our company, the Larry H. Miller Group, is all in, and we're looking for everyone else in the state to join us in this important initiative. And thank you for allowing us to be part of it.
Amanda, thank you. Dr. Pennington, thank you. Governor, thank you. This is exciting. So what happens next? What are we going to do now? One thing for sure is we're not going to go back to our organizations and back to home tonight and be the same. We are going to change the world in Utah, and it's going to happen at the hands of the people here in this room and at the hands of those who are listening virtually and those that are interested and engaged in this work. There is exciting work to happen. So I was the director of the Department of Health during the thick of COVID. I had a front row seat watching and observing intimately how boundaries and borders, personal interests, business agendas, profits and losses were able to be surrendered and subordinated to the good of the whole. I have watched it personally. Many of you have been engaged and watched it personally. We have learned so much as the governor pointed out earlier, so much has been learned and so much good can yet happen because of what we've learned through the COVID-19 pandemic. So I'm excited to be able to engage together. So the way we look at this going forward is we've got two basic sets of timelines that we're looking at. One is between now and kind of like the end of January sometime, where we will organize an advisory board. And this advisory board will be responsible to basically design this collaborative, so that between the end of January or somewhere in that time frame to sometime in May or June, that this collaborative will actually be designed, and we will establish an official governance team that will actually govern the work of the collaborative. So we hope that by sometime around June or July of this next year, we'll be able to announce the launch of the operations of this collaborative to start taking on these initiatives and priorities to start making the collaborative changes and scaling changes across the state. So the thing that we need from everybody, first of all, is to be able to contribute to ideas or names of individuals that should be a part of, first of all, this advisory team. Some people have asked as we visited with them, have we already selected the team? We haven't. In fact, we've spent very little time talking about the names. We've been so focused on what we want to accomplish. We're confident that if we get the right people in the action, we can go somewhere that we've never been before. So we need your input on who should be on the advisory team, the advisory board, who should lead it. And we also, if you have insight as to solutions that have been innovated and created that are already existing that can fix the problems that we're facing today, we want to hear about them. We don't want to start from scratch. We want to build on the things that are being done already at your hands and in other parts of the nation. So we have a kind of a link that, or a website that we want to share with you that's just a way to go dump information to us so that we can get your thoughts. The website is healthcollaborative.utah.gov. healthcollaborative.utah.gov. So one quick run through of some basic fundamentals that the governance team will be responsible for doing, just so that we can set a little bit of the stage for that team. Number one is this governance team must represent a diverse set of principles, or I'm sorry, a diverse set of perspectives that include the groups of people that we've been talking about today: employers, patients, state government, payers, community-based organizations. We've got to have the right diversity in this group. And we have to be able to have this group keep in mind the purity of the vision and not become corrupted by the money or the politics that potentially could consume the vision and render this collaborative ineffective. So that's number one. Number two is those, and kind of to build on number one, those from historically underrepresented groups will have not just a seat at the table, and they won't just be heard, but they are absolutely essential, integral to creating the solutions that we need. So we need to pull all of these groups and these individuals together to represent what is the best for the state of Utah. Will also help establish the goals, the priorities, and set the initial path forward, and to be able to put in place the beginnings of the modeling and the pilot testing that would be done on these priorities to be able to create the solutions that are needed. Those are just high level. We don't know a lot of other particulars about this. One thing we do know is we know the vision. It's going to take a tremendous amount of effort and collaboration to be able to make it any different than it's already become. And for that, we're excited. So the governor has agreed to take some questions. If we have any questions, we've also got a group of individuals here sitting with us that have been queued up to be able to respond to questions that the group has. So now we'll turn the time back over to the governor for any questions that come from you. Governor?
Thank you, Rich. Members of the media, please. Yeah, sure. So the idea behind this is it will be a public-private partnership. So the two sides working together. And what's great about this is because we do have Medicaid in the government portfolio, we have the ability to utilize some of the innovations that come out of this very quickly, and to try them out in that space. We've done some of that in the past. We know, as you heard from Dr. Pennington, this is what's fascinating. There are good ideas happening all over. I mean, there are lots of people doing great things to drive down the cost of health, been able to scale them. So Medicaid and PEHP, which is the insurance provider, between those two things, we have the ability to scale to a pretty large population fairly quickly. And so as we can prove some of these things out, so think of this, one part of this is Shark Tank almost, right? Where we vet them through the experts, and then we get to implement them. We run some trial projects and see that they're working, and then we scale it. And we have the ability, the public sector side, to scale to a pretty large audience fairly quickly, and hopefully save taxpayer money, increase health outcomes. And we also, one of the things government is good at is data collection and data measurement, right? So we can get that instant feedback from what's happening with our population pretty quickly, and then be able to share that. But we expect that to be balanced on the private sector as well, and the nonprofit sector, as we are all working together, and seeing the same thing, that as we try some things out, see what's working, we're able to share that with the private sector and get it implemented on that side as well. Well, so I mean, we have expanded Medicaid here in the state. We did that via a ballot initiative, and so we have again, we have broad services available. What we haven't done as good a job of, and we had some legislation last time to help us do this, but is to help get more people who are eligible signed up for Medicaid. And we through the pandemic, some of that has happened. Of course, through the pandemic as well, people have stayed on Medicaid even though they may have lost eligibility. So there is going to be a time when that goes away, and a lot of people who have coverage now may lose that coverage, which worries us as well. So trying to make sure that we are connecting people with the benefits wherever they get that. Some people do have the ability to get insurance through their work, but can't afford it. And so, it may be cheaper. And we've had some programs like that where we help people to get on their private insurance as opposed to just dropping it all and getting on to Medicaid. So that's where we can do better, I think, and that will be some of the discussion. Some of those inequities that we talked about, right? People who don't have access probably qualify, but don't know it, or haven't been able to navigate or go through the process to get that done. And I think that's one area where we can do better collaborating together. Thanks, Sonia. Other questions? Can we do it out there so the people who speak Spanish don't judge me? Okay, we'll do a little bit afterwards. Thank you. Anyone else? Okay, I believe that's a wrap. Again, I just want to thank all of you for your service, for your dedication to this. Let me be very blunt to conclude. I know that some of you are thinking, I know, I can see it on your faces. You're thinking, yeah, we've done this before. We tried this in the 90s. We tried this in the early aughts. We tried it, maybe some of you tried it in the 70s. I'm not going to judge any of you, your age. I know you're thinking, yeah, it sounds good, but this is just political speak. This is just another politician saying some stuff, going to drive down the cost of healthcare. We've heard that for years and years and years. It never happens. We might fail. 10 years from now, you might all be back in this room with another governor having a very similar conversation. It's very possible that we will fail. But I do believe that if this is something that we really care about, and I'm here to tell you that I do, I'm here to tell you that Rich does, we can do this. Utah's different, guys. We really can make a difference if we will come together. But you have to leave your biases behind, okay? You have to leave your preconceived determinations about how this is going to end behind. You have to leave some of your biases against your competitors behind. You have to leave some of the baggage behind that has been here before. And if you'll do that, if you'll really leave that baggage behind, and if you'll just try, just come together, we'll knock down walls to make this happen. Maybe it can't happen anywhere. Maybe it's impossible in the United States of America. Maybe we are just destined to have increasing healthcare costs and worse outcomes. Maybe that's who we are. I don't believe that for a second. But I will say this, if it can happen anywhere in the United States, it can happen here. But it can only happen because of you. So let's put all the garbage behind us and let's work together and let's see if we can make something happen. Thank you for being here.